I just want to address the issue of QR codes. We know that QR codes have been mandatory for quite some time in areas such as hospitality venues, so restaurants and pubs and clubs and so on, or pubs. What I want to emphasise is that people need to use those QR codes. In the hospitality facilities, use the QR codes. If you go to a cafe or restaurant, use the QR codes. I've certainly detected just in my wandering through the city a degree of apathy. Some of the restaurants and cafes are not asking people to use the QR codes. A lot of individuals are not using them. So we really need to take this particular virus and the variant of the virus extremely seriously. I want to add to this that obviously in shopping centres there are facilities such as nail salons and so on that have a compulsory requirement, and we have been asking people to use QR codes in retail shopping centres and particular shops. But we are actually now emphasising to each of those shops and to the large shopping centres that you must make available those QR codes. We may be knocking on your door asking who's been in your shop. We need to have that information. New South Wales Health Tracers need that information. I also want to emphasise one other fact. Last year we talked about this particular virus when it first came to our shores as being obviously dangerous, but it wasn't a long jumper and it wasn't a high jumper. We talked about the necessity for the 1.5 metres social distancing. That is still crucial, but we also need to recognise that this Delta variant, the Delta variant of the COVID virus, is actually a gold medalist when it comes to jumping from one person to another. It is a long jumper. So take it very, very seriously. Follow the guidelines that New South Wales Health and the New South Wales Government have established. We're all in this together, but if we want to get out of it together, safe and sound, we need to take very seriously using QR codes and making sure we maintain our distance wherever possible. Thank you.
Junction. Is it safe to assume that you think that there has been some contact there? And secondly, with that, the lady in her 20s, are you saying that someone can be infectious, a few moments after catching it initially?
No, and this is the whole premise. So let me take the questions one at a time. So the first one is, no, there is this period, and we think it's probably about 24 hours at a minimum, but it's actually up to 14 days where you can become infectious. And that's why we ask people that are close contacts to be in isolation for that period. So there is a period. If you've just immediately been in contact, you are not infectious yourself. So that is why we're asking people to immediately get a test after we usually are getting to people very quickly within 24 hours of their exposure. And what we're hopeful for is we actually get to people before and put them into isolation, and we have a negative test when they go into that isolation. That means that they have not had the opportunity to then go and transmit to the community. So that's the whole way contact tracing works. And earlier this week, we've seen cases where when we have gone in, the families were negative. So in the cases that the Premier gave as an illustration today, all of those close contacts in that household of 5 tested negative when they were put into isolation, but many days later, some of them developed symptoms, and when we went back and retested everyone, the whole household actually acquired the infection. So this highlights the importance of adhering to us. When we tell you you are a close contact, it really does mean you are at risk, and the symptoms of COVID, particularly for fit young people, can actually be quite mild. So don't risk it. Please follow the health advice. We rely on the community. We do check, but we do rely on the community to comply with our advice. So that's in relation to that. In terms of the child, the primary school child, I'm not going to speculate. The child has been interviewed with the parents. All avenues of investigation will occur. I suppose what's pleasing is that it's in the geographical area that we know we are concerned that transmission could have happened. I would be much more concerned if this had been a case in an area where there are no geographical links. But we are looking for those crossover points, and what we like to do is find that more specific person who's transmitted to that person, and if we can, capture the time of event to make sure we're not missing people.